In clinical psychology, few challenges compare to the diagnostic collision of two entirely distinct cognitive profiles that present with nearly identical surface-level behaviors. The first profile is intellectual giftedness, defined by extreme cognitive capability, advanced reasoning, and accelerated learning. The second is autism spectrum disorder, characterized by underlying neuropathological deficits in communication, restrictive behaviors, and a lack of social reciprocity. When a child possesses both simultaneously, they belong to a highly specific clinical population known as the twice exceptional. Diagnosing this overlap is notoriously difficult due to what the literature calls the camouflaging effect. The traits of each condition actively mask one another. Extreme cognitive strengths, advanced vocabulary, and robust pattern recognition can easily compensate for and effectively hide underlying neuropathological deficits. Conversely, severe behavioral rigidity and profound social deficits can entirely obscure a child's supreme intellectual giftedness. Diagnosticians are typically siloed. A clinician usually has extensive training in either gifted education or autism, but rarely both. By filtering historical literature through strict methodological standards, we can isolate the exact psychometric differentials that separate intellectual giftedness from an autism spectrum disorder. Failing to disentangle these profiles has severe consequences. Brilliant minds are erroneously pathologized, or critical developmental needs are tragically ignored. The historical literature on the co-occurrence of giftedness and autism is noisy, heavily reliant on contradictory clinical anecdotes and subjective case reports. To build a reliable diagnostic framework, researchers must apply a strict methodological filter, separating systematic identification measures, or SIM data, from unsystematic observations. To qualify as SIM, a study must utilize quantitative, norm-referenced intelligence measures, specifically documenting an IQ threshold of 120 or 130 and above. It must also utilize criterion-referenced diagnostic tools for autism, such as the ADOS or ADIR. Non-SIM data consists of case reports, parental interviews, and clinical observations that lack quantitative rigor. When relying solely on non-SIM data, the camouflaging effect is heavily exacerbated by subjective clinical bias. A comprehensive 2011 systematic review dropped 25 peer-reviewed publications into these two buckets to map the clinical consensus. The vast majority fell into the non-SIM column, leaving only a select few studies with true quantitative rigor. Establishing a valid differential diagnosis requires clinicians to weigh this objective SIM data far heavier than clinical intuition. Why do these two profiles so effectively camouflage each other during standard behavioral observation? The review extracted a 59 characteristic trait matrix from the literature. When we filter specifically for traits marked S for similarities, the overlap becomes clear. Both populations frequently exhibit intense, absorbing preoccupations with restricted special interests. Both demonstrate excellent factual recall and extreme rote memory capabilities. Both groups are highly capable of divergent thinking and complex nonverbal problem solving. Most confusing for clinicians, both populations frequently present with profound deficits in social adjustment, resulting in isolation from peers. If a diagnostician stops at a surface-level behavioral checklist, these shared traits guarantee a high risk of a false positive for either condition. Breaking the camouflage requires looking past the surface behavior to analyze the underlying mechanism driving it.
We must refilter the trait matrix, isolating characteristics explicitly marked D for differentials by the SIM literature. Consider the etiology of social isolation. A gifted child is often isolated simply due to a lack of intellectual peers. The twice exceptional child is isolated due to a true neurological unawareness of social rules and a lack of reciprocal communication. Physical behavior offers another differential. True motor clumsiness and significant discrepancies between reasoning and motor skills indicate ASD pathology. They are not typical traits of giftedness. We also see distinct language differentials. The advanced vocabulary of a gifted child is precocious, while the speech of a twice exceptional child is formal, pedantic, and typically lacks prosody. True differential diagnosis relies on identifying these specific neurological limitations, rather than confusing them with environmental maladaptation. Behavioral observation has its limits. It is in deep psychometric testing where the camouflage begins to mathematically unravel.
This chart maps data from a 2008 study by Goldstein and colleagues, which analyzed the four major Wechsler factor scores: verbal comprehension, perceptual reasoning, working memory, and processing speed, across different IQ brackets in ASD populations. The baseline psychometric assumption is that in typically gifted populations, these subtest scores generally elevate together. But in ASD groups with a full-scale IQ over 120, a specific and severe drop occurs. One subfactor score plunges downward, standing in stark contrast to the elevated surrounding metrics. This is the social context factor, which comprises the picture arrangement and picture completion subtests. The literature also reveals a second major psychometric differential: significant, jagged discrepancies between verbal IQ and performance IQ, rather than the parallel tracking expected in typical intelligence profiles. High-functioning autism frequently correlates with isolated peaks in block design or nonverbal reasoning, standing against average or comparatively lower verbal scores. Extreme cognitive strengths invalidate standard baseline assumptions. Granular subtest scatter analysis is mandatory to reveal the hidden pathology of ASD. The clinical data suggests that the standard approach to these twice exceptional students requires a change in focus. Most practitioners rely on classification-based assessment, which seeks to place a child into a single binary label. But as we have seen, the camouflaging effect makes these labels unreliable when used in isolation. When one condition modifies or hides the other, forcing a single classification fails to account for the actual needs of the student. This is why the literature advocates for needs-based assessment. Instead of searching for one category, clinicians map the student's unique profile of risks and protective factors, identifying exactly where they require support and where they possess supreme ability. This protocol relies on two pillars. First, comprehensive psychometric testing, to map the structural discrepancies we've identified, like the jagged variance between verbal and performance IQ. Second, it requires multidisciplinary observation to determine the exact etiology of social deficits. This ensures we distinguish between a gifted child's lack of peers and a neurological unawareness of social rules. Stopping at a single diagnostic label risks subordinating a child's profound talents strictly to their developmental limitations. A needs-based framework is the only way to break the camouflage. It ensures that cognitive exceptionality is cultivated, while the specific neurological challenges of autism are accurately supported.